Hello, my name is Dr. Holly Mintz. I am a pediatrician and Chief Medical Officer of Elliot Ambulatory Services for the Elliot Health System. I'm here today to try to inform you and answer some of your questions that you may have about RSV. RSV stands for respiratory syncytial virus, which is a virus that in older children and adults usually causes a simple cold, potentially runny nose, cough, sometimes fever. In children that are younger, especially 2 and younger, RSV can cause something that we call bronchiolitis. Bronchiolitis is inflammation of the tiny little breathing tubes in the lungs. So if you can imagine the branches of the lungs like the branches of a tree, the tiny little breathing tubes, which are like the twigs of the tree, are called bronchioles. And in children under 2, sometimes this virus has the propensity to cause inflammation of those little breathing tubes. What that leads to is something called bronchiolitis and potentially can lead to pneumonia. This often will cause coughing, sometimes fever, and often some wheezing, and at times some difficulty breathing. RSV is a virus, so there's no medication for it. There's really only supportive treatment. So for the most part, when any child or adult has RSV, you treat with supportive care like you would any other common cold. Rest, fluids, and fever control for comfort. However, there are times that RSV will cause some respiratory difficulties in young children, again, especially under 2. What this can result in is what we call retractions, where you can see the ribs sometimes with breathing because they're working so hard to breathe. Sometimes children will be breathing so fast that they're not able to eat or drink. And often you can hear what's called a wheeze, which is a noise that they're making when they're breathing. Most of the time, RSV can be treated at home if there's no difficulty breathing. Even if there's wheezing or noisy breathing without any distress, the symptoms can be treated at home with observation and again, encouraging fluids. If your child seems to be having difficulty breathing because you see, again, what we described as retractions, or they're not able to drink, or you just feel like they're having a really hard time breathing, the best thing that you can do is to call your primary care provider. Right now, the emergency rooms and the urgent cares are incredibly busy with all kinds of illnesses. And so in order to understand if you need to go to the emergency room or the urgent care, it would be best to check with your primary care provider. They will ask you a variety of questions about how your child is doing and what your child's symptoms are. And then they will make the determination if you can either stay at home and observe your child, bring your child into the office for an appointment, or if things are severe enough, they will send you and direct you to the emergency room or the urgent care center, depending on their assessment. Again, this is something that we see every year. We see it often as early as September and sometimes as late as May, but there happens to be a particular spike in RSV cases at this time during this year. There is no vaccine for RSV. Unfortunately, vaccines have not been found to give and provide long-term immunity for RSV. So it's often something that people can even get every year. This is why, unfortunately, there's no way to prevent it, other than with the typical measures that you would use to prevent any kind of spread of a cold, which is adequate hand washing. If people have symptoms, it would be recommended to wear a mask if you're going to be around little children, and making sure that you're staying in or you're keeping your children home if they have symptoms so that they're not spreading it to other children. I hope that this has helped. And I encourage you, if you have any questions about the symptoms that your child is having, that you call your primary care physician. They'll help you to understand if you need to have your child evaluated, if there is a test necessary, which sometimes is not necessary, and what you can do to help your child through this illness. Thank you very much.